Now, to tell us what all this means for the medical community, for you and me, let's check in with Yahoo Finance's medical contributor, Dr. Dara Kass. Dr. Kass, good to see you here again. What's your take? You hear that the government's, funding Novavax to the tune of $1.6 billion. Are you encouraged by what's happening at that biotech firm?
I think that I'm encouraged that they're funding vaccine development and that they're funding other therapeutic ideas, and we're getting closer to some sort of therapeutics or vaccine for this virus. I will say for the Novavax product, I don't know anything about it. It hasn't published any data. Their phase 1, phase 2 trial hasn't been published yet. They're going into phase 3, which is kind of when you expand out the safety and efficacy of the vaccine candidate to see if there are any adverse effects on large numbers of patients. But we don't have any data on this particular candidate yet. We know there are hundreds of vaccine candidates out there. So while I am assuming it's encouraging they gave this large grant of $1.6 billion to this company for their vaccine candidate, I don't know yet if it's going to be effective at all to actually be coming to market by the end of 2020 or 2021, because we have no actual scientific data yet.
Dr. Kass, Dr. Fauci was out yesterday, I think, shedding some light on some of these early vaccines, maybe not lasting as long or being as impactful as a vaccine theoretically should be. Why would that be the case?
So I think that we're learning a lot more about the immunity response and the antibody response to this virus and how long the antibodies may last for, which would confer longer lasting immunity. This may be a virus that we have to have an annual vaccine for, a booster also. It may be a multi-phase virus. We don't know yet. And so I think Dr. Fauci is trying to let people understand that this is still a lot of unknown information, and that generating a vaccine this quickly for something this new is unknown to us. And we're going to have to continue to ask questions and answer them and be patient while still moving forward.
Dr. Kass, want to get your thoughts on Regeneron. That's another company that has received government funding for its antibody test, which is actually going to be entering phase 3 right now. What do you know about this? And should we be optimistic about it?
So the Regeneron product is actually an antibody treatment that uses the idea of antibodies to actually use either preventative treatment or early stage treatment in a cocktail form. It's actually two different medications coming together. And I think that these are the innovations we're going to be looking for. Innovative, creative ways to actually attack this virus from combination effects, much like we do with HIV. Remember, we don't have a vaccine from HIV, but we've learned how to live with the virus. We've learned how to treat the virus early. And now we're seeing it pivot to really a chronic disease. I think we're going to watch a lot of different candidates come through. So I'm encouraged by the Regeneron process and their treatment. I think we need to look also, it's vaccines, therapeutics, and testing. And right now, to me, testing is the one, like what we talked about yesterday with BD, that will help us really get back to a workplace that's reliable and consistent earlier than either the vaccine or the therapeutics.
All right, we're going to leave it there. Dr. Dara Kass, thanks as always for joining us this morning.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.